Hello, I'm Dr. John Hancock, Executive Dean of McGovern Medical School. In the immortal words of Star Trek, space is the final frontier. And if we think about it, as we boldly go exploring space, medicine will need to play a crucial role. So how do we go about training doctors to deliver medical care beyond the final frontier? In response to this challenge, our Department of Emergency Medicine, led by Dr. Ben Bobrow, has created a unique program to prepare physicians for space exploration. Let's learn more from our space medicine team about why specialized emergency medicine training is key to future space missions.
The whole topic of space medicine has really evolved. You know, as people are traveling longer in space, the whole question of how do you care for people as they're traveling in space, takeoff and landing and things like that, but how do you take care of people for long periods of time, for days, weeks, months in space, and eventually on other planets, which is going to happen in the near future. And so our team's really excited to be part of the sort of the research and implementation of medical care during space travel. Decades ago, the medical care was under what's called preventative medicine. We train on how to take care of all types of medical emergencies, and so our specialty really, I think, is perfectly positioned to now help take care of astronauts in space, and that's sort of how the whole concept of space medicine, really as an emergency medicine subspecialty, has evolved.
With the help of our commercial partners and under the tutelage of expert mentorship, we created a novel curriculum that focuses on this burgeoning sector and addressed those gaps that had been identified by professionals within the industry. I am proud to say that our hard work has propelled the UT Space Medicine Fellowship to be among the most competitive in the country.
At our starting point, it's not what prevents this person from flying to space, but rather what does it take to fly this person safely? And that's a big change in the mindset of a lot of the people in this field. The space medicine program at UT Houston stood out to me due to its solid core curriculum, its advanced aerospace engineering courses through Texas A&M, and its close integration with multiple commercial space partners. In these past few months, I have provided medical training to multiple NASA astronauts. I'm taking advanced graduate level engineering courses, working at the busiest level 1 trauma center in the nation, teaching emergency medicine residents, dedicating time to study space medicine textbooks, and gaining hands-on training with multiple commercial space entities.
We're in the mecca of aerospace medicine here in Houston with Johnson Space Center right down the road. There's so much history here. John Kennedy gave the famous "We're going to the moon" speech just right across the street at Rice. So there's so much history here, and there's such a heritage of space exploration here. This is the place to be.
We're really on the ground floor of something that's going to be enormous, and I think we're perfectly positioned because of UT Health Houston's relationships with NASA and SpaceX and Blue Origin and these other private space entities, and our willingness and our interest to kind of be trailblazers. I think we're perfectly positioned to do this.
The future of space medicine is bright, thanks to our dedicated space medicine team. Thank you for joining me for this episode of Hancock's Headlines.